First at 5, an update now on vaccinations in South Carolina. People, of course, want them, and the state simply does not have enough. The Department of Health and Environmental Control held a briefing today of the state of the pandemic and the effort to get people inoculated. 7 News reporter Ann Maxwell kicks us off with the latest new information.
Dr. Brandon Traxler took this opportunity to remind us that more than 6,000 South Carolinians have died of this disease since the start of the pandemic. She says the doses the state is receiving are remaining stagnant, and it's going to be months before we can achieve herd immunity. South Carolina is set to receive between 60 and 64,000 first doses of COVID-19 vaccine this week, plus a similar number of second doses. But that's only a fraction of what providers have been requesting.
Beginning 2 weeks ago, we saw a significant increase in the amounts of vaccines that were being requested, whereas the number of doses coming into the state still was the same as we've been getting in previous weeks.
Interim DHEC Director Dr. Brandon Traxler says the biggest challenge right now is the limited number of doses, not just in South Carolina, but around the country.
We have not been given a timeline from the CDC at this point. We've been told to expect to keep receiving what we've been receiving for the foreseeable future.
In the meantime, vaccination efforts are ramping up. Prisma Health reports it vaccinated more than 9,300 people one day last week. Some Walmarts are also now offering vaccinations.
The vaccines are saving lives, but it will take months before enough of the population has been vaccinated to get herd immunity established.
The latest data available on DHEC's website shows nearly 1 million people are currently eligible for the vaccine in Phase 1A. More than 182,000 first doses of the Pfizer vaccine have been administered, and more than 18,000 Moderna doses have been administered. About 313 vaccination appointments have been scheduled. Experts say the vaccines appear to be effective against new strains of COVID-19 that have emerged. Dr. Traxler says no cases of these variants have been identified in South Carolina, but the state's public health lab has been on the alert for mutated strains since June.
And has continued to do so and has become even more diligent about carefully and actively looking for those instances of variants in our state.
DHEC's board is meeting tomorrow, on the agenda determining the allocation of COVID-19 vaccine. In Greenville, Ann Maxwell, 7 News.